conversation on the side. Before we even start the show, there's an issue I'd want us to quickly look at. The Greater Accra Regional Minister, a few days ago, granted an interview. It had got to do with the demolition of properties, landed properties at the Sakomo Ramsar sites. People had spent millions of cedis to put up structures, illegal structures, by the way, because where these structures are situated, they weren't supposed to be there. And so there was a demolition exercise, and I saw videos, and if you see the extent to which people have built, some of them even complete, they only needed to even just paint it and then finish the rooms. All these investments gone to waste simply because some proper channel wasn't followed. The laws of the country were not followed before these structures were put up, and so action had to be taken. Now, the Greater Accra Regional Minister told the Ghanaian people in an interview that some of these individuals who supervised and who gave the permission to these people to build illegal structures had to be transferred to northern Ghana as punishment for their actions and inactions. Now, this generated a lot of rancor. A lot of people were unhappy by these comments. In fact, some of the commentary was that she had been known for making, for the want of a better word, unguarded statements sometimes, and then they feel that sometimes it would be better if she never commented on issues at all. A lot of people would remember that even during her vetting, she spent less time, minimal time during the vetting process. And a lot of people even say they suspect that it's because of some of these reasons that, you know,
the majority didn't push it.
Exactly. They didn't really put her to a rigorous vetting, you know, exercise. So
Were
yes.
there no minority members?
Both the minority and the majority.
Okay.
Yes. They did not put her through a rigorous vetting process because it is believed, people
the
believe,
rot would have come out.
Yes, people, it is alleged that, you know. But I initially also was very critical of these comments that she made.
Okay.
You know. But let me read exactly what she said.
What she said,
okay. This is what the Greater Accra Regional Minister said. Some of them have been transferred to the north to serve as a kind of punishment, in quotes. So, in quotes, and then, I mean, as a kind of punishment, ellipsis, and then the quotes closed. Which means that there were other things she said in continuation of that remark, which was left out. Okay.
So that would have provided a context.
Exactly.
Okay.
So the context that provides is that these people, when transferred, would have left their families behind. You know, would have left their families behind, and of course.
So we are punishing the family if they are children.
Exactly.
Punishing the family,
so,
not the individual.
There's something I want us to look at, and I want us to look at it clearly. I mean, I love the northern region with a white hot intensity of 1,000 suns. There's no pun intended. There's a lot of sun in the northern region, but that's not exactly what I mean. I've been to the north. I've been to all the 5 northern regions. It's a beautiful place. They have their issues, you know. Every region has its issues. Maybe Accra, you would say it is minimal because development is more here than every other place. But then, are we saying that people are not transferred? Workers are not transferred to other regions as punishment for some things they have done. I'm here in this country. I've seen headmasters of school transferred to other schools for certain things that they have done. I've seen teachers being transferred. I've seen policemen being transferred, not with their will, against their will. They were transferred. So I'd want us to look at it from this point, that if you transfer me to another region, extempore, I wasn't prepared for it, I hadn't planned for it, you just transferred me, it means that I'm going to have to look for money for accommodation. If I have to go with my family, I'd have to go and look for a school for my kids. It's a different, this one altogether. So isn't that a punitive measure? Are we saying that that is not a punitive measure? That is the angle from which I want us to look at it, rather than the collective notion that, okay, the northern region is a bad place to live, and so
at least she didn't say northern region, she said north.
Yes,
so the 5 northern regions
exactly
are all affected.
Exactly. So is it rather than looking at it from that angle where we say that okay, the northern region or northern Ghana is a bad place to live,
and they give us the opportunity to look at both angles.
Yes,
so that instead of confining us, it will be better that way.
That's why I'm also looking at it from that angle.
Yes,
you are not necessarily in her defense, but I've seen people being transferred.
Yes.
See, honorable, me, if I lived in the northern region, let's say I work and live in the northern region, I'm on a salary of say 5,000.
In the north?
Yes.
Keep saying now
in the north. Yes,
we now have northern region.
In the north. In the north. Whether upper west, upper east,
northeast region, Savannah.
Savannah or the northern region. So let's say I work there, I earn a salary of 5,000 Ghana cedis. Now, if you transfer me to Accra, I would see that as punishment. Because on that same 5,000 cedis, I'll have to come and pay more for accommodation here in Accra. Where in actual fact, in northern Ghana, I'd have been paying less. I'd have been paying less for my children's school fees. So if I didn't put in a request for that transfer, and you just transfer me, I am tempted to see that as punishment, regardless of the fact that Accra is much more developed than northern Ghana. Is it could that not be the case also?
Okay. Is there a question for me?
Yes.
Okay. For me, from all that you have said, I think basically what you are saying is that we should put emotions aside and analyze what she said objectively.
Exactly.
To see whether there is a point at all.
Yes.
Because if you use emotions, for example, I'm from the northern region.
Yes.
In fact, I was born in Northeast region. As a young man, I've lived in both northern region and the Savannah region. And I've traveled to both Upper East and Upper West. So I'm familiar with the 5 northern region. So if somebody were to say, I think she was just voicing her frustration. The fact that we have this lack of planning. And that lack of planning doesn't mean we don't have a policy for planning. It's just simple because the policy implementers just ignore the plan we have put in place. And we now have Accra such as this. A capital, if you compare our capital to Kigali, you will be so embarrassed. I'm not even comparing it to London or New York. Just Kigali, the capital of Rwanda. You'll be so ashamed what has gone wrong with us. And you look at the 1960, the plan put in place by the then leaders, and how we have ended up in a country. I keep asking myself, if we keep building the way we are building, I wouldn't want to be alive 100 years from now. Because it would be so miserable to live in the capital. So I can see the frustration she was expressing. In the end, the comments that she has passed have now taken a national stage to see whether the comment is appropriate. So we've now left the subject matter of what you were saying. So let's look objectively by saying, I will transfer you to northern Ghana. Was it her intent, or she tried to make a point and she misspoke? For me, it looks as if she misspoke. It looks as if she was saying that we'll transfer you from where far away as a form of punishment, even though she mentioned in the north. But transferring to the north to sometimes can be a punishment, depending on how you look at it. Let me explain. I'm from there. Look, years when we were going to create the other regions out of the north, Savannah region and Northeast region, among some of our campaign, we're saying that we have been so deprived.
Yeah.
Because the northern region, despite Savannah and then northeast have come out of the northern region. The northern region remained the biggest region.
Yes.
So if Savannah and northeast region were already inside it, we were deprived. And I think her statement is a call for the government to push more resources to the 5 northern regions. We are really, really deprived. Since independence, we have been shortchanged, and Ghana will probably need to address it. So let's use that opportunity to address this thing. But I believe that she misspoke. She actually meant will transfer you as a punishment. And the question would then be, should we be transferring people as a punishment? If this individual were to have young children who are actually in schools in Accra, in an attempt to move I'm not saying there are no good schools in Accra, but in a way it will bring disruption to their lives. If what we just meant is to punish that particular individual. So that aspect, I don't really see it to be a point. But nevertheless, we are not talking about this statement alone. People said they have got records of her being like that. I mean, her making similar statement. I cannot talk to those things she has said which has not come to light. Nevertheless, we have got some few people that way who have an attitude. It's a form of stereotype. But the fact that you are from a particular geographical location, you are less of a human being than somebody from other areas. I think if she's like that, I am glad that it has been expressed. Some of this, let's not drive them to the background. The essence of free speech is some of these ideas to come to light so that we can challenge them. So that is why I'm in favor of free speech. People should say what they believe in. Me, I would rather want to hear people who have stereotypes and prejudice always mean to speak their mind rather than bottle it and do other things behind the scene. So for me, those things we need to, as I said, I've not heard her say any other thing other than this. And with her, with what she has said, I understood in the context that if you misbehave, if you're in Accra, you are meant to do something, you don't do it, we'll transfer you elsewhere. That will be far from you, or that can be detrimental to you.
So that is exactly what she said.
The context.
In context, said, according to her, such officers are sometimes moved far from their normal places of residence. Yes. So,
and I'm also in favor of people being moved. Most of our corruption is because people have not been moved. If you move people, the kind of comfort they used to have and the connection and the network they have in committing corrupt practices, sometimes movement can discontinue them for the meantime.
Right.
So I think transferring people, not necessarily punishment, but as a way of even fighting corruption. Can even help us.
Honorable, there's a stark reality that I feel that we have become very emotional about this particular issue, but there is a reality, and I'm going to give evidence to that reality. Look, it is no rocket science that the North has been deprived of development. Even to the extent that some people, some doctors, some public servants are posted there and they refuse to go. There are some communities that they are posted to and they refuse to go. What I do know about this government is that even with teachers, this government has decided to incentivize teachers who would agree to go to these places. So in as much as we can be emotional about the situation, we know that the reality is that these places are deprived. And people, public servants who are posted to these places are not happy working there because of the fact that basic social amenities that they are supposed to have access to, they do not. So that's the reality is there. So already there's that notion that if anybody is transferred to that part to go and work, it's some form of punishment. So rather than attacking the person who has made the comments, haven't we failed to look at the reality that yes, truly, Northern Ghana has been deprived of development for several decades. It is not comfortable living there. if you were,
especially Upper West.
yes, if
Upper
you were,
West is seriously deprived.
very deprived.
Yeah.
So in as much as we can attack.
It doesn't mean Northeast, where I come from, is not deprived.
It is. I've been to Northeast.
If I compare it to Upper
I've
West,
been to North.
I ask myself, why do they pay taxes to government?
I've been to Northeast. I've been to
Yes.
the regional capital. It is not anywhere near some of the communities that people wouldn't want to live in, even here in Accra. That is the truth.
Very true.
So, in as much as we may attack her for saying these things, the stark reality is that, look, when you go to these parts, and it's not only northern Ghana, even southern Ghana, apart from the greater Accra region, most of the communities in the other regions are very deprived. We know that.
Yes.
Why are we trying to embellish the whole situation and be so emotive about it? That, look, she didn't speak well. That is the reality.
Yes.
So if, for instance, anybody is going to work at these places, already they see it as punishment. Honorable, isn't that the case? Wouldn't you see it as punishment if somebody was transferred to Afram Plains North, Kwewu Afram Plains North, to teach, when you know for a fact that there is no internet access? Your people may not be able to watch you currently on TV right now because there's no internet access at Kwewu Afram Plains North.
Thank you very much for the opportunity. I really want to say the comments and statements by state officials are authorities that are referenced in governance and development of a nation. And like a company, the MD or the operational manager or whoever is in the helm of a unit of the company, the words he puts out are so serious and then tells how the company is running. And so, as much as the debate has now veered on your platform now to how undeveloped the northern region is, and that is why someone will refer to the whole north, the northern sector of Ghana. As much as we are all aware that comparatively the northern sector is not as developed as the middle belt to the southern sector, the context in which the regional minister was supposed to speak, make comments, make statements, or put a fact to, did not have anything to do with the development disparities of the country Ghana.
Okay.
It had mainly and specifically to do with why there was a demolition in the site where the demolition went on. And whoever or those who were responsible of making sure that those structures were not there at the time, but because of some negligence, some corruption, or some bad attitude, they put those structures over there. So I would want to leave out the northern undevelopment of this conversation and deal with the particular matter, which is the demolition, and say that, you see, we all used to say that an Ekwapen man knows how to say Oyabwa. Mpacho. So, like, he's insulting you, but they said our grandparents, no, our fathers say there's a way of beating the chief. That's when you are barbering his hair. Okay? You are using the comb to hit his head. And he knows this guy is beating, but you are barbering his head. So he cannot hold you to it. Now, I want to say transfer policies are attached to every civil or every public employment policy. Okay? Public employment policies does not specifically say, if I employ you in Accra, where I have branches all over the country, once you live with your family in Accra, you are going to live in Accra all the years of your work. So which means there is anticipation that some way, somehow, good or bad, you are going to be transferred somehow. We transfer directors from Accra to, let's say, Savurugu, because there's a specific job over there which must be done and done well, which we need this director from Accra, because of his expertise and how he works, to go and what? Finish that work. Don't we do that?
We do.
So it is the mention and the choice of words that attaches to the very conduct and the acts we are describing. That is what makes the statement bad or good. It is not out of place when you want to punish a subordinate of yours to transfer him or her to another place, like we are suggesting, to discontinue what? To discontinue an act, to discontinue a chain of corruption. But you see, as a manager, when you assume a public speaking position, your choice of words shouldn't tell your public that you always do this because you want to do this. Now, when it happens like that, when you are using a good intention, when you have a good intention of trying to put a public officer to Navrongo to go and correct a process for the betterment of the people, he thinks it's a punishment. So as we speak now, you just mentioned my constituency, Afram Place, where teachers are now being incentivized before they could apply for Afram Place. Meanwhile, let me tell you, the list of Afram Place students that have finished training college, unemployed now, waiting to be employed into the system, are more than 2,000. I have the list.
Wow.
But you see, because of the notion and how we speak about the places, immediately they are employed and they are being sent there. They are from there, but they tell me as if it is a punishment. Okay, that is that side of it. So I think that the minister had a very good intention in continuing an act of corruption and corruption-related activities in planning of Accra. And she wanted to destabilize that link so that a good work would be done. Therefore, she or whoever is in charge applied the acts of transferring them from there. But it is the statement that has generated all this.
I want to ask you a question.
Yeah, please ask.
If she had said that they were going to be transferred to the central region or the Bono region or the Ashanti region or Eastern region, would they have generated the same, ruckus? Would they have generated the same, response?
That is why I said it is the choice of words. Okay. Even if you are transferring someone from Accra Central to Bawe, and you attach that it is as a result of punishment, so Bawe people will feel that, okay, when the person is bad, you bring them to where? Bawe. Because now let me tell you, I have a typical example. Now, if you go to GRA right now, GRA is doing a mass transfer from Tema to Accra to Tema, from region to region, so that so that they can now cut short some of the negative acts that they've identified. Okay, but once they didn't come out to see
corruption, yes, a way of fighting corruption, yes.
You see, now what we are facing is when you mention a specific geographical location attached to the statement.
You see, Honorable, so I'm also again I'm looking at it from this particular context. I understand your point, clever point, but then if someone is being transferred against their will, and we've already established the reasons for which anybody
that is what there is nothing called transfer against your will.
Oh no, there can be transfer if you are being transferred at the spur of the moment, extemporaneously. Like today you are going to this region. Why?
Honorable's claim is because whenever an organization that has national president employs you, there's always a presumption that you could be
anything could happen at any time.
Yes. So I also understand your point that if your transfer is made and they connect it with a region that they are not happy about, maybe that can be
a form of you understand my point. So of course, so I know for a fact that even if you serve in the police and you serve in one region, it is not cast in stone that you'll be in that region all your life. You could be transferred anywhere else. But there may be reasons behind your transfer. The institution or organization may not be ready to transfer you because, let's say, there's an expertise that you would offer in that region that nobody else can offer, but because of some of your actions that would have necessitated that transfer. That is what I want us to look at. That the reason behind this transfer is not because the Tema Development TDC, I don't know if it's TDC. It is not because at this point in time they are undertaking transfers. No. That is not the reason. The reason is well known. A group of people who supervised the illegal construction of property at places where they were not supposed to be constructed are being moved because of that action. They are being punished because of that action. So it is not also because these people.
You used two words here.
Yes.
You said moved.
Yes.
And then you said punishment.
Yes.
I want to tell you there are two different words. Move is consensual.
No, you can be moved and it may not be consensual. Honorable, you can be moved. But
the question is, do they need your consent before they move you? Maybe contractually they don't need your consent.
Yes.
You can always be moved at any time.
Yes.
But what I think you are afraid of is victimization.
Yes.
As a result of your behavior.
He's not coming with that word well.
And victimization. If the authorities are not happy with you for whatever reason, either you because of your behavior,
yes,
or even you have done something against the interests of the transferee in particular. So
or you may have done something that is inimical to the interest of the organization.
Yes.
In this case, of the people who have been transferred.
It's a form of victimization. No, punishing you.
In the case of these people who supervised these illegal constructions, they have undertaken actions that are inimical to the tenets or the ethics of the organization.
Yes.
And so they are being punished for that.
Yes.
And they are being punished for it.
Okay. So what's your point? Whether the punishment is right or is it wrong?
No, it is not about the rightness or the wrongness of the punishment. It is the admission. It is me saying that they have been transferred to these places as punishment for their actions.
Good. Okay. Look, you see, that intention was clear from the statement that the transfer was an act of punishment.
Yes.
Okay. What aroused the public role is the fact that it was attached to a geographical location.
So why are we emotional about it?
Good. It is. You see, anytime you.
So why are we emotional about it?
You
because we know that the reality on the ground is that these places are deprived.
Yes.
We just want to name. Yes. I feel that we just want to name a dog. How is that expression? And then just hang it. We just want to give a dog a bad name and hang it. We know the reality. It is true.
So that's why I said
it is true.
That's why I said my point that we are deprived. It's actually a call to improve services in those areas.
If we develop Afram Place North, people will be happy to be transferred there.
No, but there are some
like in the next 4 years to come in.
I pray so.
No, but we are actually living an era, not just Ghana, an era of urbanization, whereby people are moving to large cities. Because the city dwellers have disproportionately taken part of the national cake.
Exactly.
And that is why decentralization is a better way forward. Instead of our concentration, every development in the cities, we need to spread them across. And this is why when you compare us, I don't always want to compare with advanced countries. But the reality is that, aside London and others, in United States, the capitals are actually in the village. If you look at New York, the capital is actually in Albany. Look at even United States itself. The capital is in Washington, which is not a major city. If you look at Illinois, the capital is in Springfield. So most of them, the capitals. Alabama, the capital is Montgomery. So I think we need to probably do that to send some of these departments to other. And I think that one we have to praise the MPP government for that. When we created the new regions. So we had in mind that all the departments, regional departments are not going to go to the capital. We are going to move them around. So I think from our region, in the Northeast region, I think Agric is sent to Mamprogo Maduri, and the others are sent to Wale Wale. Some are sent to Charpone, and others were sent to Nalilego Gambaga. To the extent that the Nalilego people were not very happy. They said, why did you give her an empty capital? You're giving her capital, but things are sent elsewhere.
Yeah.
And I think if we begin to do that, move this things
decentralization,
around, it even has the capacity to decongest Accra.
That's true.
I think Accra is, I don't want to say unfairly congested, because the resources are concentrated here. Look at our sisters coming from the north, the Kayaye, and other things.
Exactly.
If the opportunities were to be there,
They
we would not
wouldn't be
come
here.
here.
They wouldn't be here.
You see, there is a lack of opportunities, is why people come here. So it also boils down to national planning.
Yeah.
Why can't we plan properly? Or we should diversify resources in such a way that whatever you can access in Accra, you can access them in the north. Especially we have bar schools. That one is a reality. Why can't we have resources to do the same thing? The then northern region was so big that we have been, we were shortchanged. So dividing this region into three, there was a need to push resources to Savannah region and Northeast region. Because if you compare the capital, Depengo, Nalego to Tamale, it's a well apart.
It's, well, yeah.
So why can't you do that?
Yeah.
It's a call on the NDC government that governance is continuity. Don't say you didn't create those regions. And that we are glad that the president is coming from one of the new regions. So it's up to him. And he's also a northerner. For me, I mean, he's also from the north. So this is a call on him that, look, your government should prioritize the 5 northern regions, and particularly Upper West.
Yeah,
Upper West is seriously deprived.
And if we give priority to the development of these regions, we wouldn't have to incentivize, public servants before they go and work at those places.
Yes. Very true.
Yeah.
Very true.
Right. If you are just joining us, this is the national agenda. We have exhausted about 40 minutes on this particular issue. on this particular issue. But let's head to our main conversation for the day. We are looking at the health sector, two separate topics. One, we are looking at the no-bed syndrome. Remember that a few months ago, I think about 2 months ago, an unfortunate incident happened. One Charles Emisa was hit by a vehicle at Kwame Nkrumah Circle, and the National Ambulance Service were quick enough to come to the scene, and they were able to stabilize him. What followed would be something that would leave the entire Ghanaian population in awe. After going to 3 different hospitals, they all denied him health access. The reasons behind that, there were no beds. As a result of this, Charles Emisa tragically lost his life. A committee was set up by the Ministry of Health to probe this particular matter. They have their findings. Let me give you the key findings of the committee. 1, Charles Emisa was alive throughout the referral process after a hit-and-run accident near the Kwame Nkrumah Circle overpass on February 6, 2026. So this was exactly 2 months and a day ago. He died from excessive blood loss. In medical terms, they call that exsanguination, described in the report as a slow death from medical neglect. The ambulance reached Police Hospital at about 10:43 p.m. Greater Accra Regional Hospital, which is the Ridge Hospital, at about 10:58 p.m. Kolebu Teaching Hospital at about 11:20 p.m. None of the hospitals properly triaged or stabilized him despite receiving him alive. Basic emergency procedure such as controlling bleeding, wound packing, IV fluids, and blood transfusion were either delayed or not initiated. The committee stated that interventions at any stage could likely have saved his life. And so these were the key findings of the committee that sat on this particular issue. When it happened, a lot of people have spoken, but what it has also exposed is the lapses, particularly in our health sector. And of course, when I talk about the health sector, it's also about the people in this sector. Honorable, I don't know if you would remember when this issue happened particularly the member of parliament for Afajato South, he passed comments on it in parliament, on the floor of parliament, and he said that a few months prior to this particular event, he himself had, yes, he was involved in a medical emergency.
He was given priority.
When he went to the hospital, they didn't want to attend. They told him there were no beds. It took the intervention of his wife to come and say, you know that this is a member of parliament.
And when they realized who he was,
they found a bed for him.
Yes.
So that is very critical. That
is very frightening.
Very frightening.
You have to be treated based on who you are.
So when Honorable Year goes to the hospital and there's no bed, they can find bed for him. But me and you,
they recognize him. Provided they recognize him.
Yes.
That's what I was going to even say. Because I normally would go to places like that, not showing up that I am this
in your capacity as MP.
That. And then even at restaurants, it's when they realize the man, it seems his security has his back. Then he's an important man. Then they start treating you. But see, let's come to the matter. Look, ambulance picked up Charles Emisa. 11 minutes after, arrived in police hospital. One, the report said the ambulance was also defective in a way.
Okay.
So the stabilization that was supposed to be done in the ambulance was not done.
Okay. It wasn't done at all, or it wasn't properly done.
It wasn't done.
Okay.
Yes.
So that is why they hurriedly went to the police hospital so that they could find help. Now, when they go to the police hospital, why did the report say that the doctor there lied to the committee? They didn't tell what lie it is. But if you read into the matter, you will see that getting into those public facilities, you will see even a security man can give you an information, which is not supervised by anyone. The nurse at the post, for some kind of motive, like the Afajato example, can give you an information unsupervised by anyone, which is untrue. It is only you, the supervisor, then, or the one in charge at that moment, that can tell what exactly should be done.
Yeah.
Because I'm sure that if the doctor had come into close contact with the patient, then he would have even said, if you have a stretcher, then let's move the stretcher off the van and then use it to stabilize it before we look for bed. But you see, the nurse come to tell you that, we don't have bed. The security man say, here you have brought him. Here, there's no bed. There's no bed. Then negligence is not treated. He gets to the Ridge Hospital, which is supposed to be the regional hospital. You know the incidents of Ridge even before Charles Emisa.
Yeah.
The fight between the patient and then the nurse.
Yeah.
Please, it is undoubtedly a fact that when you get to our public health facilities, some of our health workers are jokes. You are dying and she's watching TikTok. She's writing your name and is watching her phone before writing the particular. Then you come back to you and say, what did you say? Then now she rather or her starts shouting on you. So professionalism in our health sector has been thrown to the background so much that those days we used to call these professionals that they have a calling. You see a nurse with a calling, a teacher's calling, nurse call, and so you meet a nurse by the gate, and before you even get to the consulting room, she had already helped you to be stable before even getting to the doctor.
Yeah.
What do we see nowadays? We just have an influx of people who want a stepping stone to enter into some profession. If it is the nursing, then he wants to be a nurse to enter into the services. He wants to maybe have a quick visa because the nurses earn more.
Or they just want a job. No passion, nothing.
A job. And you see,
yeah.
that I bring down to what the society is nursing us to be. I mean us. Because of the communal nature of the country we had in those late 70s, early 90s, we cared for each other. And so even at our workplace, that communality instinct was in us for us to help. But now in our professions, it is not there. I'm waiting for the 8 to 5 to pass so that I leave.
Yeah.
And that is what has eaten into such pertinent professions like the health sector. And you see, we have deficit in infrastructure, no two ways about that.
Yeah.
We have deficit which the system must what? Resolve. No matter which government it is, we have it. And which we must look at as a country to resolve. But yet still, if we have all the infrastructures, but we have bad characters manning the infrastructure, we'll still have the same problem. We'll still have the same problem. And so I think we should tackle this in two ways. As government is trying to fix the infrastructural deficits in our health centers, we should as much as culture the health professionals, okay, to feel the calling of serving. I had friends who came out from outside this Christmas, and when they fall ill, they don't even want to go to our health sectors. They are health workers. They say when they go to our health centers and they see how the professionals are attending to people, they fear they will die here. So they quickly want to run away.
It is very true. I've heard that.
It is just an attitude and behavior. I was saying this morning on Atenka that, look, I'm a trained teacher.
Yeah.
And in all this training, whether in the teaching field or in the nursing field, there's something we call improvisation. As a professional, you are always trained to improvise something where there's nothing, unless there is nothing to improvise with. So if we use bed syndrome, the no bed cases as excuse for letting Charles Emisa die, then it is no excuse for a professional to talk about. Because even benches are beds.
Yeah. In cases of emergency.
Are we saying that if we go to Ridge Hospital, we go to Police Hospital, we go to Kolebu Hospital, there are not mattresses installed that are not on beds that can be put on benches to stabilize the situation? It is the attitude and the instinct we have towards work. If we correct that, we can. That is when you even have the mandate to hold government responsible as a professional. But I can tell you, if we walk here in t-shirts to Ridge or Police Hospital to Kolebu right now, and we approach a nurse by a gate and say, "Oh, we have a problem. Oh, can you help us?" The first thing he will do or she would do is to complain, "Oh, I had a new bed. Gloves cry, nyam fan ye dumo. So who bet me a copy dia? What does it do to you? If you like, let's drive to
No,
right
I know. I know.
So you see, the person had already killed you before you even get to where they will resolve your matter. So it's an attitude thing that we all must change and pay attention to what we want to do for country Ghana, and I think we'll go forward.
Let's look at the recommendations of the committee. It says disciplinary action against doctors and nurses involved, referral of implicated staff to the Medical and Dental Council and the Nursing and Midwifery Council of Ghana, and urgent reforms to Ghana's emergency healthcare system. We know that earlier the Kolebu Teaching Hospital had interdicted 2 doctors and 2 nurses, and I think they are still investigating the matter. They've not concluded on this as far as their hospital is concerned. But Council,
yes,
you're a lawyer. Yeah. This is a case of res ipsa. Res ipsa, the small 2x4 law that I know. Okay. This is a case of res ipsa loquitur.
Yeah.
Repeatedly, we've seen these things happen.
Yes.
And more often than not, a section of the public involved who bear the brunt of this do not see the legal part where they could have explored, the legal part of this to get some relief from this hospital. So I was having a conversation with some of my colleagues here at Pan-African TV yesterday that res ipsa is there, especially in the medical field. Yes. But it appears that only a class of citizens are able to pursue it legally and take these hospitals, to account for their actions. But
Yes.
for poor people like us, you know,
Yeah.
certain things happen. There's a clear case of medical negligence, but
Yeah.
you can't even acquire the service of a lawyer. You decide not to even talk about it at all. I'd want us to touch on it.
Yes.
And if still
Yeah.
Charles Amise's family can decide that, look, we are taking this issue up legally.
Thank you very much. I think I have opportunity of teaching in this area of the law, tort law. We call it tort law, civil wrong. So tort is the Latin to mean civil wrong. So I've taught tort law for 3 years, and area of medical negligence is always quite interesting. In fact, there is a new trend called wrongful birth and wrongful pregnancy. So when you are born wrongly, can you even take your periods off? If they should have gone for abortion, or somebody had allowed you to be born, and you want to even take the person on. So the McFarland case, Reese case, they are well known. It's also very interesting because I'm also a registered nurse. I've been a nurse for at least 21 years.
Oh,
yes. So I practice in the UK system. I'm specialized in mental health. I've also worked in accident emergency and triage, as well as resource for some years now.
Okay, so the right pronunciation of the word is triage.
Triage.
Okay, not triage, like I said.
So triage system is where you go for assessment. They direct where you need to go.
Right.
So when you come to triage, I've worked in triage for some number of years. So when I see problem of this nature, there are 2 ways I can look at it. What really caused this to happen? There are personal failings and there are systemic failings. So the personal failings could be attributed to the individual personnel involved. The systematic failure, because I've had the opportunity to look at the reports now, and I also share my personal experience with you. Accidents I've witnessed, and even the Ghanaian in general to rescue, that we have a problem. So let's talk specifically to this particular report. This person, when he was found, so it was a hit and run situation. So already this culture of hit and run is not a one-off, it's a recurring thing. We need to put system in place. Elsewhere, even if it is an accident, especially, it's also come to tort law. So usually there is no burden on individual to act, except if you have caused a dangerous situation.
Okay.
So if it was merely an accident, you have a duty, since you have now caused the situation, you have a duty to report it. So that side has failed. Now, an ambulance has come in to help, and even inside the ambulance, they couldn't even take the vital signs, simply because the calf was taking the blood pressure. I think the gentleman said it was ripped off. I watched it on TV a bit. Either it was ripped off or it wasn't working. And the question is, a calf of a blood pressure machine is so cheap as $1 to $2. Why are we having only one in an ambulance? And moreover, one calf cannot use for every individual.
Exactly.
So myself and you will probably use one. But there are my younger one and there are mature ones. Didn't they have any other calf? One calf in an ambulance. It's troubling for me. And then you take that, they have taken this person all the way to the hospital. Does that mean we don't have the triage system? So the triage system is where we assess, even though people have arrived before you, but is your case serious?
Yeah.
If it is serious enough, do you have to go to A&E major? Do you remain in triage main ward, where they can just give you 2 or 3 treatments, you go? Or should we take you to resource straight away, where if there's a cardiac arrest or myocardial infarction, somebody can intervene immediately. We should have that system to identify who need care first. So in the triage system, it is not who arrive first.
It's giving priority to yeah.
And now all those things couldn't be done. And because they said he was losing blood, the people who were inside the ambulance and where he arrived, we do not train in emergency medication to find out how can we really stop a blood flow. Because we know that from accident where blood is flowing, it's either trauma that will kill you or this blood being drained out of your system. And they even say that they could have given a drip and other things to increase the blood volume. None of that was done, and yet this individual was even turned away. So look, this report is not beneficial to Charles Anwisa anymore. It's beneficial to you and me. It's about how can we stop you today or me tomorrow, or even me today or you tomorrow, from passing through similar fate. And from what you have said, any one of us, it could happen to us. So for me, those people who turned him away, what was the protocol in the hospital? And even if a protocol tells you to turn people away when you reach a particular number, as a nurse, as a professional, should you be doing this? And I think it ties down to what the Honorable was saying about calling. For me, I don't want to use calling. Calling sounds so biblical. I would probably call it passion. Do you have the passion for the thing you are doing?
Like Florence Nightingale.
Florence Nightingale.
Yeah.
And so do you have the passion for what you're doing? If you are simple going there because there is nowhere else they will accept you, then we have a problem. Or this is the only job I can get for the meantime. You could see that so many nurses, sometimes they just abandon their posts and go for other recruitment, especially immigration or custom.
Yeah.
I've had so many nurses approaching me for custom or even the military for them to go. Even nursing is merely a stepping stone for them. So people doesn't have passion. And one of the qualities of a good nurse is empathy. Not even sympathy, it's empathy. So empathy is putting yourself on the shoes of the sufferer. Yeah. That if you were that person, how would you want to be treated? And I think the empathy is seriously lacking in many places. And I think adequate training as well. You could see it in the ambulance staff all the way up. It's like there's a gap in the way people are trained. And I'll tie it to two personal experiences I have had, and that has troubled me. There was one time I went to a hospital in the Northeast region. They were taking blood, this is a BP, and somebody oxygen saturation was about 93. And the individual, the nurse, were not escalating it to the doctor. So I asked the nurse, and I was connected to that person who was the patient. I asked the nurse, why don't you escalate this to your doctor? He said oxygen saturation is 93. I said, oh, there's nothing wrong with that. I said, what? Have you heard World Health Organization guideline? If oxygen saturation is 95, you have to report it. The person has to be given oxygen therapy. You don't know that. So where is the doctor? Oh, the doctor is out of town. The doctor is going to Tamale. Okay. But do you have oxygen you could give to that person? No oxygen. No oxygen. My goodness. We don't have these things. And look, and another time I witnessed something. I was going to Tema on one Saturday around 2016, and I was on my way back to Accra to take a flight to Tamale. In fact, I missed my flight as a result. These military people were coming from Tema to Accra, and their car somersaulted. They had an accident, somersaulted, and then fell in the middle of the road, and there was some gap, and not far from me there was a fire service station. I don't know whether it is still there. And the members of the public came and they were trying to rescue the person from the car. And you know the method they were rescuing. Fire service were not involved. In most countries like Britain, they call the fire service. They were just there. There was no emergency people. So, but what troubled me was the fact that the mob was trying to lift it.
That would have even, if you went dead, that would have killed you.
It was troubling. Yeah. So, as I said, I have worked with A&E, rescue medicine. I've gone with ambulances for years. So, I asked my guy to stop. He said, listen, your flight is about 45 minutes away. I said, it doesn't matter. This person could die. Yeah. So, when I went there, and they tell you in accident, trauma is what often kills us. Yeah. The panic that I could die. Yeah. When that panic keeps increasing, the trauma, eventually if you don't take that, you die out of the panic. Yeah. And this person, you could see he was frightened. So I got there and I tell the people, please help, just support me. I'm going to see what I can help. I'm specialized in this area. So instead of leaving it out, leave it. Let me see what I can talk to the person. So I managed to get to the other side of the door. Obviously they say observe your surrounding. If there's no obvious danger, you go in. So I observed there was no obvious danger. There was just small drip of water. It wasn't petrol. So I was able to talk to him. I said, can you hear me? He said, yes. And I said, I want to talk to you. I'm a specialist. And I want you to work with me. And I asked him, is your leg strapped anywhere? He said, no. If I ask you to lift your right leg, are you able to lift it? He said, yes. What about your left leg? So me, you are not trapped? He said, yes. And I said, okay. We are opening this window. I'll just hold my hand. Whatever I tell you, you do that. I directed him. He came out of the car. And the crowd was so happy. And now you can do whatever you want to do with the car.
Yeah.
But you don't leave with the car with somebody there. So you can say the public have a passion to help, but they are not trained in rescue.
Exactly.
So this thing should have been done by fire services and perhaps police to some extent. But in most countries, this is a fire services job.
Yeah.
So that aspect of the training, we are failing it. Then you come to facilities. Believe it or not, especially when COVID-19 happened. This is where Honorable might disagree, but I'm not doing politics. When COVID-19 happens, the then MPP government audited, and they realized that, as Honorable also accepts here, that we have shortage of facilities. How can we expand our facilities? It was for this reason that the then government said there was a need to build more hospitals. And that is what the Agenda 11 came into play. So with this Agenda 11 identified, the then MPP government tried to build as many hospitals as we can. As the Agenda 11 means, there were 111 hospitals. Economic pressures couldn't help because we are now in recession. Having left, I thought the NDC government would have prioritized these things and complete them, because the money that our government used then were not for Akufo-Addo or Bawumia. It was for the Republic of Ghana. And if it's the Republic of Ghana and we are in the, especially when you campaign on research and the spirit of continuity, especially we need them. Now, I mean, this current situation tells us that we need more facilities to be built. One would have thought that their priority would have to complete them. This is why I said they should take a second look about putting kiosks across the country just to take blood pressure. I'm not saying they are not needed, but the priority is to have hospitals, and then they can come later if we have enough hospitals. Because I have not seen, trust me, I have traveled a lot, I have not seen that model that they are putting up. I don't know where they have copied that model from. But the Chinese have a saying that only fools learn from their mistakes. Other people have made mistakes for you to learn from. If you go to our mainstream hospital, for me, the first time I went to Kolibu, I said to myself, what has gone wrong? Look, the environment itself doesn't even promote recovery. So I'm not surprised that somebody will come from America and Britain and say, when they are sick, they don't want to be here. Because sometimes the environment tells you that you are in good hands. So staff are not welcoming. Environment is not welcoming. Where is the hope to recover? There's no hope to recover.
You are headed for a certain death.
So for me, there are personal failures and there are systemic failures. The personal failure, yes, I see that the report recommends that the National Midwife Council should institute disciplinary measures against them. And likewise, the General Medical Council should also deal with the doctors. What happens to our collective failure to provide facilities? And I think it's high time we invest more. And every country, no matter how struggling you are, health and education should always be prioritized. Because if you are not healthy, how do you contribute towards building the economy? And we can see this. And look, so this is the primary healthcare the government was saying, I commend them, but they also presented it as if it's a new one. It's something that you were going to continue, which is very good. I've always tell people, God forbid, if you give me a choice of having diabetes and HIV, I'll go for HIV.
Yeah, people don't.
Do you understand that?
People don't even. Yeah,
people that realize that.
Yeah,
Majority of the people, because as a man in particular, with HIV, it doesn't kill anybody anymore.
Yeah.
If you take the medication early, before it devolves to AIDS, you are fine for life.
There's I hear that it's at a point in time the virus even becomes non-reactive.
No, it's not even detectable. They cannot even detect it. There are medications now that can suppress it so much that they can have healthy children and it will not be transferred. They will not be able to infect their partners. But if you're a man, diabetes can make you blind.
Yes.
It can make you amputated. It can make you impotent.
My father died of diabetes.
You see?
So I know.
So the risk is real. But the general public are not scared of diabetes. You see them consuming sugar and then sugary products. But when you try to advise them, they don't see any problem with it. So yes, giving such advice, and if you see our health problem, much of it is down to not taking hand hygiene seriously. And this is where we emphasize it in schools. So I think the government thinking is laudable, but their priority is being misplaced. For me, they should complete the 111. If they think the credit will be given to the NPP, they are making a terrible mistake. They can equally take the credit for completing them. After all, it's the Republic of Ghana, and the people of Ghana who need to benefit. Not credit.
Right. Can Charles Amis's family still sue these hospitals?
Well, I'm not here as a lawyer. Okay, let me come to that. So as a lawyer, we use a simple test that was gotten from a case of Dinugu and Stevenson when Lord Akin propounded that particular theory. I hope I've not snapped
No, I don't think so.
And when Lord Akin brought something we call the neighborhood principle. So the first thing we ask ourselves is, do those people or the facility have a duty of care towards you? And there's a well-established case that says that professionals as well as state organizations such as hospitals, they have a duty of care. So that side we're able to take it, that we have a duty of care. And then the next question we ask is, has the duty been what? What is the standard of care? So what is the standard of care? I think the standard of care was gotten from the Barnett case. Okay, so that's a Ghana version. I'm talking about the generality, how it was established. So what is the standard of care? So the standard of care, in the case of ordinary people, it will be a reasonable man's test. In the case of so the reasonable man test will suffice. Then has a duty been breached? Clearly here they were meant to serve him and they failed to serve him. The report says so. Do you understand that? And the next question is causation. Did that cause the death?
Yes.
You see that? Yes. And I think the report also spoke to it that it's like if they had all intervened or carry out. My only problem is the chain of causation might be broken or might not be broken. So the chain of causation is where we might argue a lot in court. You see that? Because these are different actors. Because you need to pin it down to one particular aspect. Who actually caused the death? Could all of them cause the death? I think it will have a problem because of chain of causation. So you may have to pin it to one particular side that your feelings significantly contribute to death. Do you understand that? And if you cause the death, I think it's possible that negligence can be established, especially vicarious liability. So it might be that individual might not pay, vicariously those employers might pay. And if I'm the lawyer, I will not even go for the individual. I won't go for the individual. I will go vicariously to the organization who employs them. Well, I'm not allowed to advertise, you never know. But I've been teaching that area of the law.
But it's not allowed. At least the public needs to
understand, because a lot of these things happen and then it's swept under the carpet simply because the people involved do not have that knowledge about that aspect of the law, which would let them.
I don't think it's about knowledge. It's a cultural problem. It's a cultural problem. So if it is northern region, I'm from northern region. You can't say I'm speaking against northern. We have give it to God attitude.
Yes.
My father is a very religious person. My father would
especially in Islam as well.
My father would say that. So they will quote Quran ayah in the
that was meant to happen.
Yeah, they will say that every soul shall taste death, and that's God's way of us calling for Him to come. So if we have that, but we also know that other countries where God still exists, they are able to prevent them. So it might not be, some death might not be attributed to God. That if we take preventative measures, with all apologies, but I do believe that strongly, some deaths cannot be attributed to God alone. It's our negligence. I didn't say if somebody kills somebody, we should attribute it to God and leave it that way. So if the criminal law can intervene, why can the civil wrong intervene in the name of tort law?
I very much agree with you when you say it is a cultural thing, because
it's a culture.
Even so, there are some high-profile cases. For instance, I remember in 2009, the then member of parliament for Tamale Central, Honorable Inus Afuseni, in 2009, he tragically lost his wife at the police hospital. His wife, an unborn baby. His wife was pregnant at the time. He lost his wife at the police hospital, and it was as a result of
medical negligence.
But he decided not to sue because of, I think his faith. And then he felt that it was
but for me, Islam doesn't prevent me. If you are negligent, I will sue you. I don't think Islam prevents us from doing it. I think Islam actually wants us to sue because we can improve the system. If we're suing, people will be careful. Whatever they do, it helps the system to improve itself. But if you keep leaving it to God, it doesn't provide opportunity for people to change. So I think God wants justice. And suing provide an avenue for justice. And it's because it's a cultural change. When I'm teaching tort law, anyway, I've left tort law, I'm now teaching human rights law and international law. When I used to teach tort law, the question doesn't see the point in this law because we don't use it in practice. And I said, no, tort law, we need to use it. But they don't see the point because of the culture. So maybe some new lawyers will need to take out this aspect. Maybe in UK we call something ambulance chases. So whenever you see an incident, go there and say, do you need a lawyer? I'm there to say. New lawyers could do that. You could become an ambulance chaser, chasing every ambulance.
Right. Let's look at another health-related story. This one has got to do with the Wejagbawe Hospital. The Wejagbawe Hospital has been in existence for some time now. I live in that vicinity. The Eswal administration saw to the construction of a facility that was to serve the needs of children, just children. So it is the pediatrics, that would be the pediatrics department of the Wejagbawe Hospital. Beautiful edifice. It is probably, I've seen it, it is probably bigger. The facility is probably bigger than the rest of the hospital combined. Yes. That facility alone, it is bigger than the rest of the hospital combined. I live there, I've seen it. I see it all the time. So I thought that it wasn't stocked with health equipment. That was why it wasn't open. But this demonstration opened my eyes to the fact that it was well stocked. Everything was completed. And so why hasn't it been open to the general public?
Politics.
You understand? So I have seen I've cited a press statement that the health ministry issued, and this is what it says. Operationalization of the Weja Pediatric Hospital. The Ministry of Health has noted with concern a demonstration that took place at the Weja Pediatric Hospital today, May 5, 2026, and wishes to state the following. The hospital is a World Bank funded project which commenced in 2023 and was expected to be completed in December 2025. However, in 2024, the World Bank raised concerns about misprocurement, which included inflated costs of medical equipment up to about 11 times the actual price. As a result, the World Bank declined to settle all the outstanding payments. Recognizing the importance of the project, the Ministry of Health engaged relevant stakeholders and was prepared to commission the facility for use. However, the contractor subsequently halted this process, insisting that all outstanding issues be fully resolved before granting access to the hospital. There's a certain disconnect that I do not understand. When this statement is saying that in 2024, the World Bank raised concerns about misprocurement, which included inflated costs of medical equipment up to 11 times the actual price. As a result, the World Bank declined to settle all the outstanding payments. But then it is saying that, recognizing the importance of the project, the Ministry of Health engaged relevant stakeholders and was prepared to commission the facility for use. So it wasn't because it still wasn't completed. There's no question about its completion. Yes. However, the contractor subsequently halted this process, insisting that all outstanding issues be fully resolved before granting access to the hospital. The ministry wishes to assure the people of Ghana that it is actively engaging all stakeholders to resolve the matter in the best interest of the public. The ministry acknowledges the critical importance of the hospital within Ghana's healthcare delivery system, particularly in providing specialized care for children. We wish to assure the general public that the Ministry of Health is committed to working assiduously to ensure the full operationalization of the pediatric hospital. The ministry therefore appeals to the people of Wija, in particular, and the general public at large, to exercise patience while steps are taken to operationalize the hospital. Now my question is one, Honorable, why is it still hasn't told us why the hospital has not been operationalized? No. Is it because the contractor says no? That is the impression that I'm being given, that the contractor has not given the go ahead for the hospital to be operationalized because there are some outstanding issues.
Yes, thank you once again. When you read the content of this letter, and then the initial issue raised about the funding, which means it's a World Bank project. And if World Bank raises a red flag, then it means that some amount of funds had been stopped from entering into the coffers of that project. And mind you, the contractual obligation between the contractor, the consultant, and government might not be the ones that government has full control. The contractor might be expecting his full payment before releasing the property for use. And so when he comes back to say that we agreed that we will commission the project, then it means some talks went on and say, though your said so and so amount had not been paid to you, we wish to commission the project for use whilst we deal with the specific matters of payment or other obligations that we were supposed to give to you, the contractor, in delivering this contract. And if maybe somehow the contractor agreed but later on declined that, no, per this condition, unless I am being paid before I'll release the project to you, then you can't go ahead. So it all depends on what kind of agreement and the terms of agreement that government, the World Bank, and the contractor had. So if it has to do with full payment and then release of facility, then that might be holding the time for which they should have commissioned the facility. But if that is not the case, then you and I right now here cannot tell what is delaying a project that has been completed and every equipment inside it. What will delay it from being commissioned? Do we even have to commission before we use? Do we have to? This is a hospital. Do we even have to commission before we use? So I am thinking the caveats that is holding the hand of government not to use the facilities because payment has not yet been done fully for it, and the contractor might have been insisting that I want payment before you can have access to. Because listen, we even in my constituency, there were some projects that the district assembly were carrying out. That's the former government the district assembly were carrying out, where the contractor was contracted to fully fund the project, and then payment will be done by government when the project is completed. But the project is completed, government has not paid, so the contractor goes away with the key and say, the day you pay me, the day I'll hand over the key to you. So those projects will be stored until government finds money to pay for the project before the project can be used. Some of those contractual agreements hold us and tie us to such kind of situations as we can see in the Wage Agbawe. But I think with the government's commitment, His Excellency's commitment with completing most of the legacy projects that had been left behind, I don't think at this time it will be a problem for the minister to quickly resolve all the caveats and issues around the hospital and get it working, because that is why we call for governance. That is why we change governance. So on this medium, me discussing why he didn't do it or not will not be much of my burden right now. It is an appeal that whatever it is what is holding his hand not to commission that must be corrected as soon as possible, because Ghanaians need that hospital. And that is what he must pay attention to. If maybe he didn't look at that direction earlier on, then now it is time for him to quickly go and correct and cure that canker over there and allow Ghanaians to use the hospital. That is surely what I'll say about the Wage Agbawe Pediatric Hospital.
Right. Let me give you more details on this particular facility. Yes. It is a 120-bed ward. Has a NICU, that is a neonatal intensive care unit, a pediatric intensive care unit, and it has emergency units and an accommodation for caregivers. And so it's an all-inclusive, facility. And like we already established, the project was funded by the World Bank and constructed under the Ministry of Health to reduce pressure on overcrowded facilities like Kolebu Teaching Hospital and then Princess Marie Louise Children's Hospital. Of course, you said you are a trained nurse, and of course, yes, I'm sure you know there's what this hospital would have done, yes, if it had been commissioned. On your part, this is a project that your government started, So what happened? Why?
Honorable said nobody can tell why it is not open. Of course we can tell. You see, the summary of it is that NDC as a party scam Ghanaians into government. In fact, this is a scam government. They think they can just say anything to win power. Look at the report. He can even say that from the report that has been released, we are not able to know what caused it not to be open. He ran to World Bank funded project, and that there were inflated prices. What is the connection with inflated prices and the hospital not being open? He's not able to tell us. So they were doing politics. And then the contractor took over, asked whether the contractor has been paid or not paid. That is why it is not open. They just throw in the contractor wording. Is it the contractor that is physically preventing it from being open? And what is the nature of a contract? Does a contract not being paid means that the contractor have a power to prevent government that you cannot use the facility? That is why, and therefore you cannot use the facility if you haven't paid. And if the contractor have even said that, what stopped the government from making some payment? Maybe that side is not your priority. It doesn't mean government doesn't have resources. Government have resources. When you see government not paying for a particular thing, or not negotiating to reach a settlement for a particular thing, that thing is not a priority for the government. It is. That's a gospel truth. In fact, governments have helped some first-year university students to go in because that's their priority area. So you cannot throw in words to blame a government that has made effort to start it, in fact, to complete it. What we are talking about is opening it. Not even that it has not been completed. You cannot blame the previous government anymore. You can blame us for anything, but not this. And as we say, government is continuity. And you campaign on research. The good people of Ghana have said, take over. And you should blaming people in opposition. When in fact our minority leader tells you how lonely opposition is, and yet you still think blaming them on top of that is a way you defend yourself why it is not open. It is not your priority. And you remember I told you earlier, government will need to prioritize healthcare delivery and education if you want to succeed. For me, this particular aspect and your primary healthcare policy, some of the things you say you would do as part of primary healthcare, I believe these are not the priority areas. A facility that we are already struggling. I don't know how many children hospitals do we have in the country.
Yeah.
Children hospital is usually a specialist care unit, because the diseases affecting children is not the same thing affecting adults. In fact, some children hospitals I've seen in Britain, they are even largely empty. For some reason, because of their preventative care, they make sure that. So most children hospital you go, if your child have a problem, it's usually you and then you family. Almost all beds, especially in summer, they are empty. It's winter, you have few people coming there. So I think this should have been a priority. The government should just say this is failings on our part. Take ownership. I've always said that the NDC government is like a typical student presenting themselves for assessment. Wherever they get A, they say they got A. But where they get F, they say they have been given F. Who give you F? And the report is doing exactly the same thing. Take responsibility and tell the people that we got our priority wrong, we will solve it. Or we don't have money to deal with this particular problem. Give us time, we will solve it. Duty of conduct, being truthful and honest to the people, should be a way a government that campaign on research should govern. Why not go and take World Health report and say it was inflated? So if it is inflated, what did the World Health Organization do that affected from being open? Did they say you cannot continue?
They said they didn't settle all the outstanding debts, the outstanding payments. But there's something.
You as a personal, how many times has individual not settled the outstanding bill for buying car, but they still drive the car?
There's something critical that there's a question I want to ask. It says the hospital is a World Bank funded project which commenced in 2023 and was expected to be completed in December 2025. It was expected to be completed in December. So there's a question I want to ask. Has the completion got to do with commissioning, or it has got to do with the facility being completed in terms of construction and being stocked with medical equipment? Because we know for a fact that the construction has been done, medical equipment are in the facility. So when it says that it was expected to be completed,
politics.
What is the expectation of that completion? Would the completion mean that it has been open to the general public, and so until it has not been commissioned, it's not completed? Is that what it means?
But even if the facility is not fully completed, if there are some facilities already there, and the people have a need for it, I mean, it can be commissioned and work can be ongoing for the remaining part.
Oh, no,
as far as the vital part is completed.
It did not say again that this wasn't the only thing about completion that it didn't state. It stated was that payments for something was not done.
So if we're looking for clarity from a minister, and he issued this kind of report, isn't that garbage? It's garbage.
I don't want to call it garbage, but there's no clarity.
It is garbage. That's garbage. You can't use it.
No. There's no
garbage,
clarity,
my friend. Don't be scared. We are in freedom of information.
Let's hear you.
I always say that most of the time when I get onto these platforms, I actually guide myself not to descend into a political quote. Because when we descend into political quotes, we forget the matter that must get to the public. And then we try to raise our right hand because of where we stand. I, as a Ghanaian, I am worried about a facility that was supposed to be completed in 2025 December. Today is May, I think May 7th. And 5 months after the supposed completion, the facility is not being used. My caution to the minister is that as much as I am a Ghanaian, I want that facility to be used. The scamish part of council's accession of NDC to Ghanaians does not come anywhere to play in this matter. When he, as a lawyer, if he wants to describe what a scam is, I'm not sure he would finish lecturing us here with what a scam is. So I think I want to plead with him not as descend into that political quote about who did, which party did this, which government did this. Me and him, he will be my senior brother small. We have a duty, okay, to call on the right things to be done for posterity to give us a credit as Ghanaians. Not to be descending into that political, not even just political, party quotes when we have pertinent matters like this to discuss. I think he should have been saying that from December to now, it's time enough so that the minister, whatever issues might be pertaining to this facility, should be clarified and then the facility be used. But saying that because you didn't get clarity in his writing, it's a scam. No, it's an understatement. That's below belt. We don't say that.
Okay.
We don't say that.
The clarity is rubbish. But I said the whole government. I don't say it's a scam.
No, we don't say that. Let's leave that one. Let's leave that one to. Let's leave that one to those who hide behind mobile phones and make those calls. We will leave that one to them. By me and him showing our face on television for Ghanaians to see, we will be guided by our choice of words and how we use them, because our children are watching as well. I think pertinently what we are saying is that the time span between the completion and then the time we are talking now is enough time that we resolve any issue around the World Bank, the contractor, and then the Ministry of Health, so much that the facility should be used. It shouldn't wait for agitations from the community, the public, before we get into to use or do the right thing into this, and that is what we should be advocating for, whether it is MPP or NDC. That's what we should be advocating for, because when he started talking about Agenda 111, he was lucky the spirits asked me to keep quiet and then walk out, because I am privy to even the audits of all the Agenda 111 projects. If the due diligence were done by Ghanaians who were in government, I'm not saying MPP, I said Ghanaians who were in government and felt like Ghanaians, most of those hospitals should have been completed before 2024. I'm telling you the truth. But you see, because they were not Ghanaians in heart and in emotion, I'm not talking about their party colors, I'm talking about their individuality and then the national instinct that is in them. People who supervise, people who work, people who spend monies, people who put their hands into those things. If they were true Ghanaians in their spirit, by now Agenda 111 would not have been a topic for a government to be discussed. But that is where we are. But you see, we must start from somewhere. If throughout 1992 till now, government had been that silly thing we had been playing, now we must be serious about everything, intentional about everything, whether it is NDC now, MPP tomorrow, CPP yesterday, or whatever. We must insist that whatever you belong to, the right thing should be done. That is what makes you a Ghanaian. Thank you.
Thank you very much.
I need to respond.
Well, briefly,
yes.
Yeah. My time is up, so.
I'm surprised Honorable is running away from the labeling. We cannot do away from labeling. As I've just presented myself here, you have described me as a member of MPP Legal Directorate.
Yeah.
And when we were in government, somebody campaigned on research and give certain promises. It is our responsibility to hold them accountable. And I cannot hold somebody accountable without naming him. So naming would always be done in a platform like this. So I'm not sure why the Honorable wants us to run away from that labeling. And if the campaign was done in such a way that it was a scam, we have a responsibility as members of the opposition to tell Ghanaians that these people have scammed you. And when they are held to account, They are not even clear in the way accountability. It's like I'm not sure how to best describe the report. So I wasn't saying the garbage was. I was actually meant the report itself is garbage, because the report is meant to serve a purpose to clarify things for us. If he cannot clarify things for us, the best way is to put in the garbage bin. Maybe he should issue a fresh one that will clarify the situation. But in the meantime, the good people of Ghana will put this report in the garbage and wait for a better explanation for him. That's the point I'm making. I'm not insulting the minister.
My time is up. My time is up. I need to go. I want to thank you very much, our cherished viewers, for your time this afternoon. It's been another very exciting and educative edition of the National Agenda live here on Pan-African TV. For the first time, I would say we tackled 3 topics. We talked about the Greater Accra Regional Minister's supposed gaffe. I don't think it was a gaffe anyway. And then we also discussed we also discussed medical negligence on the part of some health facilities in this country or in the capital relative to the case of the late Charles Emisa. And then we also looked at the Weja Pediatrics Hospital. Very interesting topics we discussed today, and I'm sure my guests did justice to them. Thank you so much, Council, for your time. It's always a pleasure having you. And also, Honorable would always take time off his very busy schedules to be here with us. We really appreciate that. The National Agenda appreciates your efforts. And to the good people of Ghana, thank you so much for supporting the show. Gradually, I see that we are picking up. We haven't gotten there yet, but I know with the likes of Council and Honorable appearing on the show, would definitely get to that pedestal that would want to reach. I'll see you hopefully next week, Tuesday. Until then, do have a pleasant weekend. Bye bye.
Thank you.